What is Lipiodol, used for in TACE liver cancer treatment? Imagine a tiny vehicle that can deliver medicine straight to a stubborn tumor in the liver. That's where Lipiodol comes into play during Transarterial Chemoembolization, or TACE, a common treatment for liver cancer. Lipiodol is an oily, radiopaque contrast agent that plays several important roles in this process. First, it acts as a carrier for chemotherapy drugs. When mixed with chemotherapy, Lipiodol is injected into the artery that feeds the liver tumor. Because of its unique property of being selectively absorbed and retained in hypervascular tumors like hepatocellular carcinoma, it helps deliver high concentrations of medicine directly into the tumor tissue. This targeted approach boosts the treatment's effectiveness while reducing damage to healthy liver tissue. Next, Lipiodol contributes to embolization. After the chemotherapy-laden Lipiodol is injected, tiny embolic particles are often introduced to block the blood vessels supplying the tumor. Lipiodol itself temporarily obstructs these microcirculations, causing ischemia or restricted blood flow to the tumor. This combination of delivering chemotherapy and cutting off blood supply helps kill cancer cells more efficiently. It's like hitting the tumor with a double punch. Another key role of Lipiodol is in imaging. Because it is radiopaque, meaning it shows up clearly on X-rays and CT scans, doctors can see exactly where the Lipiodol has gone during and after the procedure. The pattern and amount of Lipiodol retained in the tumor serve as visual markers, helping physicians assess how well the treatment targeted the cancer. This imaging capability allows for better planning of future treatments and helps predict how the tumor might respond. Lipiodol-based TACE has been a standard treatment since the 1980s for patients with intermediate-stage liver cancer that cannot be surgically removed. It is recommended by many clinical guidelines and remains one of the most studied and widely used techniques worldwide. Overall, Lipiodol acts as a multi-purpose tool in TACE. It delivers chemotherapy directly to the tumor, temporarily blocks blood flow to induce tumor death, and provides visual feedback for treatment monitoring. This combination makes it a vital part of liver-directed therapy, helping improve outcomes for many patients with liver cancer while minimizing systemic side effects. Always remember, if you or someone you know is considering treatment options, consulting a healthcare professional is essential to determine the best approach based on individual health needs.